President Obama filling in for Hillary Clinton yesterday on the campaign trail, playing up her fitness as president.
You want to debate who's more fit to be our president? One candidate who's traveled to more countries than any Secretary of State ever has.
So she's got a lot of frequent flyer miles. Well, those comments coming as concerns over Clinton's health rise after her collapse on Sunday getting into the Scooby van. Should the president really be saying those things? Let's talk to Congressman Duncan Hunter, a Republican from California. He's also a Donald Trump supporter. Congressman, good morning to you.
Good morning.
When you saw the President of the United States out there yesterday stumping on behalf of Hillary, what did you think?
I think him and the Democrat establishment will do anything that they can at this point to drag her across the finish line. I mean, that's the only choice that they have is to go out and stump for her, because I don't think she can do it for herself anymore with the way that she's feeling.
And speaking of the way she's feeling, what do you make of the fact that, you know, a week ago, anybody who brought up her health, you know, it was the new birtherism, I think one of the channels referred to it that way. But now it's been revealed, you know, that 4-minute coughing spat last week probably was related to this pneumonia thing. And now people are all over the country are calling into question whether or not she's healthy.
In the end, truth comes out. And I think with the Clintons, it takes longer than usual for that truth to come out, but it finally did, especially nowadays when everything's on video. There's no way to hide it. But I'm glad at least the American people can now see Hillary Clinton as she would be as president, and even, you know, 3 years from now into her presidency, if she were to become president, how would she feel then? And with all the demands on a president, the way it ages you and what you have to do, and the stress, I think it is important for the American people to see this, as sad as it is for her and her family to see her so ill.
Congressman, let's switch to another topic. It sounds like the Army is about to kick out a paralyzed hero. A Green Beret by the name of Tim Brummett was paralyzed after trying to save a girl. And now the Army's saying, well, you know what, we did a blood test, and it looks like he had some issues right there. He had a 0.1 blood alcohol level. Tell us a little bit about what they're trying to do to this guy.
Sure. So this guy's been on 8 combat deployments. He actually breached doors. He was an Army Ranger. And by the way, he's a really big guy. He's about 6'4", 250 pounds. So a 0.1 blood alcohol level on him is different than it would be on somebody who's 120 pounds. But this guy tried to enroll himself. In fact, he actually did enroll himself in an Air Force drug abuse and alcohol program. Told the Army, tried for about a year to get help. Sent emails. We have the emails. His family sent emails to his command saying our son has post-traumatic stress. He has issues. His wife left him with his 2 daughters when he went to Special Forces training. So he was in a very bad place. The Army basically pulled him out multiple times out of his drug and alcohol abuse program that he was in, and he did turn to self-medicating. He admits to using cocaine and alcohol, but once he hurt himself, given the fact that the Army did not help him, when he asked to be helped over and over, the onus is now on the Army to keep him and make sure he gets an honorable discharge, because he's paralyzed with the chest down forever now, and that's going to be expensive for him and his family. So the Army needs to do the right thing and give him an honorable discharge. All
right. Congressman, please keep us posted to see what happens to this guy, because we're very interested. Congressman Duncan Hunter, thank you very much.